Welcome to an in-depth exploration of the autonomic nervous system, a vital component of our peripheral nervous system. This intricate system operates largely unconsciously, maintaining our body's internal balance by regulating involuntary functions like heart rate, digestion, and respiratory rate. It controls essential processes such as pupillary response, urination, and even sexual arousal, all without conscious thought. The ANS is fundamentally divided into three primary branches: the sympathetic nervous system, the parasympathetic nervous system, and the enteric nervous system. The sympathetic nervous system, or SNS, is our body's rapid response unit, preparing us for action in moments of stress or danger. It triggers the well-known fight or flight response, a cascade of physiological changes designed for survival. When activated, the SNS dramatically increases heart rate and cardiac muscle contractility, ensuring maximum blood flow. It also dilates the pupils, enhancing vision, and relaxes the airways to improve breathing efficiency. Simultaneously, the SNS reduces digestive activity and decreases urine output, redirecting vital energy to more immediate, essential functions. Originating in the thoracic and lumbar regions of the spinal cord, specifically from T1 to L2, the SNS pathway is distinct. Preganglionic neurons release acetylcholine, which then activates nicotinic receptors on postganglionic neurons. These postganglionic neurons subsequently release norepinephrine, acting on adrenergic receptors, both alpha and beta, in target tissues. In contrast, the parasympathetic nervous system, or PNS, is responsible for conserving energy and regulating bodily functions during periods of rest. It promotes the crucial rest and digest state, allowing the body to recover and restore itself. The PNS decreases heart rate and blood pressure, stimulates digestion, and actively helps in tissue restoration. With a craniosacral outflow, its neurons originate from specific cranial nerves, including oculomotor, facial, glossopharyngeal, and vagus. Additionally, neurons from the sacral spinal cord, specifically S2 to S4, contribute to the PNS. Both preganglionic and postganglionic neurons within the PNS exclusively utilize acetylcholine as their neurotransmitter. This acetylcholine then stimulates muscarinic receptors, mediating the PNS's diverse effects. The enteric nervous system, or ENS, is a remarkable, extensive network of neurons embedded within the gastrointestinal tract. It independently controls digestive function, though it maintains communication with the central nervous system. The ENS regulates gut motility, secretion, absorption, and local blood flow, ensuring efficient digestion. Remarkably, the ENS contains more neurons than the spinal cord itself, operating through complex reflex circuits. It comprises the myenteric plexus, also known as Auerbach's plexus, which primarily controls musculature. The submucous plexus, or Meissner's plexus, monitors chemical conditions and glandular secretion within the gut. The ANS relies on specific neurotransmitters to communicate effectively with its target organs. Acetylcholine, or ACH, is crucial, used by preganglionic neurons in both the SNS and PNS. It's also the neurotransmitter for postganglionic neurons in the PNS, ensuring consistent signaling. Norepinephrine, or NE, and epinephrine are the primary neurotransmitters for postganglionic neurons in the SNS. Cholinergic receptors, including nicotinic and muscarinic types, are responsible for binding acetylcholine. Adrenergic receptors, categorized as alpha and beta, bind norepinephrine and epinephrine. These specific receptor interactions mediate the diverse and widespread effects of the ANS on various organs throughout the body. Dysfunction of the autonomic nervous system can lead to a range of significant disorders. These include orthostatic intolerance, neurogenic bowel issues, and erectile dysfunction, impacting quality of life. Autonomic neuropathy, frequently observed in diabetes, can impair nerve fibers, causing bowel dysmotility. It can also result in resting tachycardia, an abnormally high resting heart rate, and orthostatic hypotension, a sudden drop in blood pressure upon standing. Clinical testing, such as tilt table tests and Valsalva maneuvers, are crucial for evaluating autonomic function. These diagnostic tools aid significantly in both the diagnosis and subsequent treatment of autonomic disorders. Furthermore, drugs specifically targeting the ANS are widely used to manage numerous conditions, highlighting the system's profound clinical importance. Understanding the autonomic nervous system is therefore fundamental for medical professionals and anyone interested in human physiology.